They say that a picture is worth 1,000 words. The best way to explain what we've been talking about is to show you. Now, typical human spine. We have 7 cervical or neck vertebrae, 12 thoracic or mid-back vertebrae, and then 5 lumbar vertebrae that goes into the sacrum. We described the disc in the body. As we can see between the bones, except for up on the top here, we have a disc. And as we get down in this area, you can see that they even become a little bit bigger. What's interesting is, we always call it the foundation principle, that a lot of times if the low back is causing problems, it can affect the rest of the back. That's why people who develop low back pain in time develop neck, shoulder, and mid-back pain. But the concept of what the disc can do, remember we said it's a jelly donut, and we lose some of that space as we get older. The other thing is, coming from a 1/16 of an inch away from the spine, we have nerves. And if you can look sideways here, you see that there's just a little opening here between the bone and the disc. And what ends up happening is, if the disc gets smashed, it can come out here and actually affect this nerve and fill up this hole in here. And a lot of the concepts that go on in here of putting bones back in place, you can see why if a bone moves out of place just a little bit, how it's not going to show up on an x-ray as anything major. In fact, it might even be explained to you. It's not that big of a deal, not that big of a problem. But 1/16 of an inch away is the nerve. It just touches that nerve. It can cause problems. There was a study that was done by the New York Times that said that 50% of MRIs that are positive, in other words, showing disc degeneration, it gives no pain. And 50% of all MRIs that are negative give off pain that are just amazing to a person. You can get an MRI back, even if you've been suffering from low back pain, radiating pain, and it can say there was no disc degeneration. Well, there is a million little nerves that send impulses and actually put the watery gel into the disc. And if a bone's moved out of place, these nerves aren't going to fire. So what ends up happening is the disc might look normal, but if these nerves are not firing because the bones are moved out of place, it can mimic disc degeneration and cause pain in your body. That's why, as the Wall Street Journal once said, the MRIs are nothing more than an expensive picture. It was best described that an MRI is like taking a picture of a telephone. How do you know if it's ringing? It just shows you what's going on. What you have to do is have other tests, and that's the value of chiropractic, is you can have other tests that can be done. A chiropractor will go through the orthopedic, neurologic, dermatologic, the full examination, and it's not going to take very long to determine if there's a pinched nerve, how bad the pinched nerve is, the disc degeneration, things of that nature. And also when you look at the spine, you see up here this red nerve going up here. Actually, it's called the vertebral artery. About 30 to 40% of the blood flow to our brain actually goes through the upper 6 cervical or neck vertebrae. So, if a bone is moved out of place in the neck and it pinches this vertebral artery, and 30 to 40% of the blood flow to your brain gets cut off, guess what happens? Headaches, pain, discomfort. Remember we talked about stepping on a garden hose. Well, what we do with Lowforce Chiropractic, gently move the bones back in place, allowing everything to be in line, taking the pressure off of this artery, and allowing 100% of the blood flow to the brain to successfully go up there. So what ends up happening is the pinched nerve goes away, the vertebral artery does its work, and the headache magically goes away. And that's why there's a lot of problems in the body, like headaches and carpal tunnel, that are unexplained, and people don't look at what the nervous system effect has on the body. As we said, the nervous system controls every system, function, and organ of the body. And you can see coming from the entire nervous system, which is the first thing that's developed in the embryo, that's the importance of the nervous system. You must have things properly aligned, and as we get older, our posture becomes a problem. Things, go out of place, and the value of chiropractic, you can see it right here. It's all in the nervous system. That's why a lot of people who give chiropractic a bad rap by saying, oh, you have to keep going back. Well, maybe 3-4 times a year you should go back for maintenance care. A dentist will tell you need to go back twice a year, and nobody scoffs at that. And I always say, what do you use more in life, your teeth or your spine?